Happens every year this time of year. You feel like you come down with a sinus infection, but it could also be allergies. Right now, Southeast Michigan's under a pollen alert for weeds, and that's expected to last for at least another week. Joining us now to discuss this, Dr. Partha Nandi. How can you tell the difference between, because I've talked to a million people this week that say, I think I've either got a cold or allergies.
Allergies. It's hard because they can be very common. But remember, if you're getting fevers and aches, most likely not allergies, most likely a cold. Also, you know, a cold usually lasts about 2 weeks. Allergies can last a much longer time, but there can be a lot of similarity between them. So if you're unsure, go see a doctor, but those are some rules of thumb.
All right, what can you do, first of all, if you're not sure that you can treat both of them effectively, but until you figure out which one you have?
Yeah, you know, I would use, like, for example, Tylenol and decongestant, whatever your symptoms are, treat them. If it goes on for longer than 2 weeks, so for sure see a doctor, because it could be more than what you're talking about, more than a cold. It could be allergies, but you can use totally different medications to help you over the allergy season.
Okay, we'll move on from allergies and colds right now and hope everybody the best on that one and keep Kleenex handy. That's always a good thing. There's an alarming new study about stress in the workplace. According to researchers at Harvard and Stanford, stress is as bad for your health as secondhand smoke. The study found that keeping long hours at work can increase your chance of early death by almost 20%. By far the biggest stressor appeared to be people who are worried about losing their job, and those who are most concerned increased their odds by having poor health by 50%. Okay, so let's talk about it. You're always a horde. We're bad people to talk about this because we're always working.
Right, but we're not stressed at work because we enjoy ourselves. The key to me is that you got to enjoy what you do. It's easier said than done, but if you do that, that helps a lot. You know, I think that reduces your stress quite a bit.
Okay, so when we talk about what kind of effect stress is, I mean, I'm startled to learn that secondhand smoke is like equally bad on your body. I mean, what kinds of thing are stress doing to you?
So heart disease, Alzheimer's, 50% increase in mental health and physical health problems from stress at work. And here's the thing, you know, we set up situations where people are working long hours and you have stress because you can't balance what work and your regular life with your family. So I think if you can balance those out, meaning that you can have coworkers cover for you, you have more flex hours, that helps a lot. The other thing is exercise. Exercise at work, when you have facilities for exercise, that helps tremendously to bring the stress level down. And work activities, you know, with the employees, when they do things together that's outside of work, that also helps you.
Well, it makes your workplace a more fun place if you feel like you're more social there.
Steve always makes it fun for me here. He always does. He always has stuff for me to do.
Just something fun going on here. So let's talk about, you say we enjoy what we do, which is absolutely true. I get that from you, that you really enjoy what you do. I enjoy what I do, so the stress level for me is slow. I mean, although there are times when, you know, you got a project coming on and the deadlines and stuff like that. When is it time, though, to say this job is literally killing me and I got to find something
else? When it's affecting your physical or mental health. When you're going to the doctor and they're saying, listen, your blood pressure's out of control, or, you know, you're not sleeping well. And so what happens is that when it becomes that the job takes over your life, it's time to take a look and say, you know what, you're not living to work, right? You're working to live. So it's just, you know, you want to make sure that you have the balance of work and your personal life.
And for so many people, I can hear them saying right now, well, that's easier said than done. I mean, it's hard enough to find one job these days, much less find another.
Yeah, exactly. I mean, so what you have to do, reality is that you have to take a job. Do what you can within the job environment. Talk to your boss and say, is there some way I can limit my hours, or I can do some job sharing? You've got to work within the system if you can. If you have choices, take them though. You know, some people will not take the choice and say, listen, I want the promotion, I want the next best thing. And then you end up with having a health problem that limits you. So remember the important stuff. You know, your health is more important than your promotion or whatever income you get.
Okay, we'll talk about the subject that is so many minds. My daughter, her daughter, Scarlett, is going to go to school for the first time. Actually, she starts next week. And my daughter posted yesterday on Facebook, she says, I can't believe all these Facebook posts from all these parents. How can they not be going crazy right now?
Yeah, exactly.
There's the first day of school, kids heading back. I mean, how, especially if this is your first time with kids going back to school, how do you handle that?
You know, I think that what you do is you balance it out. You make sure that you remember what school is about, right? Is to get an education. You want to make sure they get enough sleep. Key is, you know, my daughter has been pushing me hard to keep, you know, the same sleep habits as she has in the summer. So what you do is you try to balance it out, make sure that they get enough proper sleep, proper nutrition, and then balance out not too many activities at school. Really important.
Now, what happens to the kids if they do come in sleep deprived at school?
Yeah, it's important because it basically reduces your attention. You can't do as well in school, you can't perform as well, and you almost have the same experience as a person with ADHD. So it really impairs your performance. It gives you optimal performance if you can get at least 10 hours of sleep a day, you know, for most of our younger kids.
Okay, also, how about eating and vitamins and stuff like that? Kids have spent the summer maybe not eating at their peak performance.
Especially in Michigan, a lot of my patients are fatigued, and one of the big things we find out, vitamin B12 deficiency, huge. Also, we have to worry about iron, potassium, magnesium. So when you're being fatigued, don't just think, hey, you know, like we're all tired. You may be having a nutritional deficiency, so check with your doctor and make sure you have a balanced diet. You know, fruits and vegetables are key, along with, you know, some meats and also fish. So you want to remember you have a balanced diet, but if you're fatigued, remember, talk to your doctor. You could have an iron deficiency, you could have a vitamin deficiency as
And you're
well.
talking about your kids here at this particular, if your kids are all fatigued, they're A, not getting enough sleep, and they're B, not eating well enough.
Exactly, or they're sitting in their room watching that TV. I am a big proponent of getting that TV out of the room and not being on that stupid phone at 2 o'clock in the morning for you teenagers who are watching.
I'm going to get back to my original question. How do the parents deal with the kids going away? I mean, we're talking about the kids making sure they get enough sleep, getting there, but the parents, I mean, I see so many stressing out about it.
Same advice. So what you have to remember is that, listen, you know what? You're not the only one who's doing this. We've all done it. We can handle it. Just give yourself the same limitations you give your parents, give your kids, and I think follow the same advice. You have to start doing some of the things you did when they were in school. So I think if you do that gradually, you should be fine.
Okay. What are you working on for 5?
You know, it's important to know about your balanced nutrition along with diet. We're going to talk about how to do that.
All right. Any specific tips right now you want to give us as a hint?
You know, I think that when you go back to school, you want to talk about, you know, kids and sleep and using melatonin. I want to make sure it's safe for you, so you got to watch and see if it is.
All right.